Many years ago, PTSD was predominantly researched in relation to military veterans, and was frequently referred to as shell shock or combat fatigue. Today, PTSD is a serious condition that affects many civilians. Post-traumatic stress disorder, PTSD, is a mental health disorder that develops following the experience or witnessing of a traumatic event. The event could be anything, including a rape attempt, a war, or a car accident. The incident must involve some type of physical injury or assault, either actual or threatened. Post-traumatic stress disorder symptoms may include disturbing thoughts and feelings, flashback, feelings that the trauma is happening again, dreams related to event and nightmares, intense anxiety and impaired memory or concentration. It also includes avoiding situations that remind you of the event. Negative changes in beliefs and feelings about yourself or the world, and being easily startled. The symptoms can be classified into 4 clusters. Intrusive memories, avoidance of reminders, negative changes in beliefs and feelings, and hyperarousal. These clusters are usually present to some degree in everyone who experiences trauma, but they are not necessarily equally severe in all people. If these symptoms last for more than a month after experiencing trauma, then it may be PTSD. The person with PTSD may feel disconnected from their surroundings and have difficulty concentrating on anything other than the trauma that caused their PTSD. They may also experience feelings of guilt or shame. Irritability or anger, numbness or detachment from others, trouble sleeping or concentrating, and a sense of being constantly on guard. The symptoms of PTSD can last for months or even years, and may make it difficult for the person with PTSD to maintain their career or a romantic relationship. PTSD has turned out to be a very common disorder. In the United States alone, it's estimated that 7% Americans are living with it. If the statistic is accurate, that means there are a lot of people suffering from PTSD in just one country. What can be done for such persons, as well as for the many millions of other sufferers worldwide? For people with PTSD, social support from friends and loved ones is extremely important. Don't hold back from encouraging the sufferer. If you have a loved one dealing with the horrible memory of some traumatic event, understand that he or she is not overreacting or deliberately being difficult. Because of emotional numbness, anxiety, or anger, he or she may not be able to respond as you would wish to the efforts you are making to be supportive. But don't give up. Be patient and continue to show love. The sufferer needs to recognize and avoid unwise coping strategies that cause further harm. These include use of illicit drugs and overindulgence in alcoholic beverages. Although alcohol and drugs may give promise of temporary relief, they soon make matters worse. They usually contribute to social isolation, workaholism, rejection of people who want to help, uncontrolled anger, or other self-destructive behavior. Consult with a competent health professional. It may turn out that the sufferer doesn't have PTSD. But if he or she does, effective therapies exist. If you are receiving professional help, be honest with that person and ask for help to overcome any of the above behaviors. Remember, physical wounds are often the first to heal. But internal injuries caused by PTSD can take a long time to heal. So if you are close to someone who has PTSD, please be patient with them and try to understand what they are going through. Offer them your support without judgment or criticism. If you enjoyed the video, make sure to like it, subscribe and click the bell icon.